patient named Thuận. He was born in 1974. The reason for referral, he has complaining of progressive limbs weakness and problem of the digestive system and sexual history. From June 2005, he has noted pain of two legs with sensory disorder. Patient visited many specialists of orthopedic with normal EMG, vascular ultrasound, MM, and lumbar MRI. From December 2005, she has begun constipation in some months, and chronic diarrhea. Patient visited specialist of gastroenterology with a loss of diagnosis, IBS, chronic colitis, with endoscopy of large intestine, hypotonics of anal sphincter. 2006, he has been getting importance. He visited some sexologists, but nobody find out past medical history. Patient don't have any special disease before, but in the family, he have half brother named Jan, born 1979, had a similar disease in 2007. He also visited a lot of specialists but didn't improve. One of his mother brother has similar disease and died due to weaken when he was 51 years old. One of his sons had gotten a similar disease. One of his mother other sister died due to chronic colitis. Another mother male cousin had a similar disease and died. This is a family tree. Patient Thuận is a son of mother is the first husband, and a second patient named Jan is a son of mother with the second husband. He had a similar disease. The brother of his mother had died due to a similar disease. Last patient had a son with the similar disease, same patient Thuận and patient Jan. And one other sister of his mother died due to a chronic colitis. And another brother cousin died due to a similar disease. From family trees, I think that this disease was caused by genes located on the X chromosome. This is a medical finding. Renal condition normal. Neurological exam. Patient had weakness of limb and proximal weaker and distal. And patient don't have arthroplastia and sensation. He has numbness has ascended in a typical stocking lot distribution, and he has wasting of many muscles of limb guide, mainly in proximal limb. At last time, I think that he has abnormal movement in the face, maybe in hemifacial spot, I'm recorded a video clip, but it's lost and I cannot to find out because it's in a tab, my old tab. And laboratory feature. It has full blood score, uh, don't have specific feature, and biochemistry report is normal. ECG, MRI of spinal cord, abdomen CT scan, normal. And endoscopy, patient had hypotonic of anal, sphincter, and eruptive gastritis may be induced. We do EMG 3 times. In the first time in 2005, normal. But in the second time, 5 years later, in July and September 2010, we had evidence of CMT type 2. These are the data of electromyography of the second time. And the second time and the third time I did it. In the motor nerve study, we have evidence of abnormal of the lower limb, tibial and femoral absent or amplitude of tibial in the left side reduced a lot, and left tibial were absent in the third time. In the sensory nerve study, the lower limb, superficial peroneal absent. And in the third time, we had a change little bit superficial radial in the right side. And EMG needle had evidence of not abnormal in an on-off muscle we examine. Summary of finding. By 7-year-old, after last time when we examined, has been gotten progressive limb weakness and disorder of the respiratory system and sexual disorder from 6 years. And when we examine clinical, had evidence of polyneuropathy and arresting disorder, chronic diarrhea, and maybe had hemispecial spasm. And family medical history may be inherited linked X chromosome. And laboratory finding had evidence abnormal of endoscopy with hypotonic anal sphincter, and EMD had evidence of chronic axonal polyneuropathy. But at this time, we don't have green statin. At this time, we think that patient had diagnosed hereditary motor sensory neuropathy links is or hereditary sensory autonomic neuropathy, and another diagnosis, but we don't find out. At this time, and that time, both of patients don't improve with any treatment, corticoid, cyclophosphamide, mycophenolate mofetin, etc. Now, both of patients passed away. Patient Peng died in 2016, and patient Yan died 2 years later. But at this time, we don't have a final diagnosis.
Okay, great. Thank you very much, Dr. Lee. Very interesting case, very difficult. So I think the first thing we should do, if you don't mind, is let's go to the family. Can you go back to the family tree? Because I think the key here, clearly we're with a genetic problem. And I agree with you. When you were showing that, I did wonder whether this could be X-linked. But the other thing that crossed my mind was, could this be a mitochondrial disorder? So, with gastrointestinal problems plus neuropathy, there's a condition called meninges, which is a mitochondrial disorder, which can resemble this. So were there any other, let's look at the family tree for the first thing, I think. Yeah, let's just stop there. So I agree. I mean, it looks like it's males that are affected, but then there was one female who died of colitis. What does that mean? But otherwise, it's all males with similar diseases. And so is the female the carrier? And so my question was, could this be mitochondrial? And in that case, did any of them have any hearing problems or diabetes, which may be clues to mitochondrial disorders, Dr. Lee? Do you know? Hello?
Yeah, sorry, Dr. Tong, can you answer question?
Yes, I think that the female has the same
Same disease?
disease. Yeah.
Okay, so that sort of puts it slightly more difficult. And so I think we have to say that, the bowel, the sexual dysfunction, and neuropathy is all, again, part of the same thing. And I agree, it is a genetic process. Could this be TTR amyloid, which is an autosomal dominant condition? Certainly, you have to think about it in anyone with neuropathy plus autonomic dysfunction. And as I said, hereditary amyloid is now a treatable condition, at least where there are facilities for that. And you don't need to have small fiber neuropathy. I was all under the impression amyloid, small fiber. No, you don't need that. You just need any types of neuropathy can be caused by the TTR amyloid. So I think that's an important possibility, is amyloid, but also I think we need to think about mitochondrial disorders, particularly with this very strong male presentation. And so there's this condition called meninges, which can affect the bowel and the muscle and nerves. The other thing which was interesting, can we go to the clinical assessment? The weakness was more proximally than distally, which is a little bit unusual for a neuropathy, which may imply that maybe there was some root involvement. Can we just go to your examination? Yeah, here we go. So proximal is weaker than distal. So that's interesting. The other thing, was there any cardiovascular autonomic dysfunction, any postural hypotension or anything like that? Or was it all just sexual dysfunction and bowel?
Sorry, Dr. Tong. Yes, sorry, Dr. Tong, can you answer Dr. Manji question?
At that time, I and many doctor exam patient carefully, but we had a really major problem. The first neurological, the second the problem of sexual disorder, and the third is had a problem of digestive system. The patient cannot absorb any meal,
Right.
any food. Yeah. Therefore, his wife always infusion for him. Yeah.
Can I ask, were there any eye signs like ophthalmoplegia or anything of that sort, Dr. Lee? Because some of these mitochondrial disorders, they do have overlaps with other features.
Also, there is a hint here because there's wasting of the muscles proximally. There's a lot of proximal wasting and weakness, which again would make me think maybe there was an underlying muscle process as well. I know the EMG didn't help, but if you've got a combination, it can be difficult. And the fact also that you did try treating the treatable option with immunosuppressant, there was no benefit. So I think this is, as you say, an X-linked disorder, or it could be mitochondrial. That's, I think, how I would summarize it. And, you know, if ideal things were ideal, maybe one would consider muscle biopsy even, or send off mitochondrial DNA mutations. There is one for meninges now, which I can't remember what it is, but there is now a mitochondrial DNA testing for it. But it's easy where we are, it's difficult where you are, I think. I don't know if anyone's got any other comments.
Okay,
somebody said TTR amyloid. Yeah.
Yeah, so I think majority of people are saying the same thing. So like what you said, multi-system problems like meninges, which is, I think there are a few other names that people use for these mitochondrial disorders.
Yeah.
Characterized by multiple systems, including ophthalmoplegia. So muscle biopsy, I think lactic acidosis in the blood or in the CSF.
Yeah, I think lactate pyruvate may be a useful clue, correct? Yeah, yeah.
And then perhaps then genetic tests, which I think we can facilitate through the Albatross platform.
They can send you the blood to Singapore or Uma?
Yeah, we can try to facilitate that. Dr. Nia can help me coordinate with Dr. Lee. So I think it does look like I agree that I think the only thing that's a bit odd about from what I understand about mitochondrial gastrointestinal disorders is that it's severe. It often causes a lot of gastrointestinal obstruction, pseudo-obstruction, malnutrition.
Yeah, they get megacolons and things, yes. You know. They get a megacolon. I've had 1 or 2 patients who've had to have their bowel removed virtually, you know, because of that. But, you know, there is a clue that I think the EMG showed anal sphincter myotonia or something, I don't know, or hypotonia. There was something in the muscle in the bowel which is abnormal.
Yeah, I'm also wondering whether the facial spasm, whether that could be another clue. I was thinking, some kind of myokymia, some kind of myokymia or something of that sort, you know.
Okay, so, difficult case, but I think it is genetic, either X-linked or mitochondrial, and I think if you can get access to genetic testing, that may give you the answer, and then.
Okay, so we'll post this in the Albatross platform for further discussion and see whether we can facilitate some testing. I think I'm just going to quickly look at the comments. I think if there are no other comments, thank you, Dr. Lee, and then Dr. Nia, shall we proceed with the next case?
Over to you, can you share your screen and present the second case or the third case of this discussion? Yeah.
Okay. Thank you, Dr. Mani and Professor Umapati. Thank you a lot.
Okay.
Thank you very much. Yeah. Very good case. It's very difficult. Right.
I think so. Dr. Tuấn, can you stop your sharing screen?